Mm-mm. You don't need Tylenol, you guys. Especially if a fever's 102, 103. There's no need to do
Correct. Not every fever needs Tylenol.
hydrated. Drinking coconut water, copious amounts of it. Hydration is the number one factor when it comes to fevers. And fevers that get too high is because the kids get dehydrated, right? The number one thing they do in the hospital for kids that come in with high fevers is fluids, right?
So a couple of things. Coconut water is actually not great for hydrating young children. Coconut water is actually quite high in potassium, and in some cases, your child might not necessarily need that high level of potassium, especially if they might be dealing with a concomitant GI virus. Instead, I recommend an oral rehydration solution. Pedialyte is a great over-the-counter option. But are fluids the number one thing we do for fevers? Not necessarily. This video is made by a chiropractor whose training likely does not include taking care of sick children in a hospital. So I recommend taking his pediatric advice with a grain of salt.